With the opioid crisis and substance use disorders at unacceptable levels, workplaces and employees are feeling its impact both on the job and at home. In this online interactive learning community, the Healthier Workforce Center of the Midwest has brought together 3 experts to share innovative ideas and best practices on how to create a workplace that is recovery friendly. The webinar begins with Anne-Marie Dale from Washington University in St. Louis. Anne-Marie is professor of medicine and occupational therapy with over 30 years of experience in clinical treatment.
Our topic today, the why and how of recovery-friendly workplaces. The reason for the name is because I think many people have different ideas on what it means, and part of this comes from the perspective you may be coming from, either whether you're an employer or an organization, a provider, or an individual in need of support. So this is what we're going to be talking about for the first hour. I'd like to acknowledge, of course, Diane and the Healthier Workforce Center of the Midwest, and also the Recovery Friendly Workplace of Missouri, who were very instrumental in supporting the development of this presentation. Today we will have, this morning we'll first of all have 3 presenters, myself, then John Narine from Recovery Friendly Leader, and Jamie Osborne from NIOSH, and then we'll move out into the breakout sessions. So of course we need to begin by defining or understanding the problem a little bit more. We all know that substance use disorder has been a problem in the U.S. for quite a long time, but in 2021, the problem has grown to a point where now we have 46 million people who have at least one substance use disorder. And those break down into both alcohol use disorder, about 11%, and drug use disorder, about 9%. But the real challenge here is the fact that overdose deaths continue to rise. And in 2021, as you know, they rose over 100,000 deaths in a single year. And recent information now is showing that the number who are seeking treatment who have an addiction is actually quite low. And therefore, we need to improve, get these individuals to treatment who have a need. The crisis has grown to a point on the right. I show a statistic that says the odds of dying from opioid use disorder is now greater, 1 in 58, compared to the odds of dying from a motor vehicle crash. And hence the need and urgency for all of us to step in and help out. There was a recent article that came out from the Addiction Policy Organization that highlights the problems for those who are struggling with addiction suffer from. And these include damaged relationships, financial problems, personality changes. But interestingly, they also have a greater chance at hospitalization, criminal justice involvement. A large number experience homelessness at some point, suicidal ideation, and then, of course, overdose. So these individuals have a lot of needs once they reach the point of addiction. And in the workplace, we have a role and a concern because it is through the development of a substance use condition where individuals are more likely to fall out of employment. This is a conceptual model. At the bottom, it shows those who have no use, controllable use, but then move on to substance misuse, substance use disorder. And as they move down that continuum, they're more likely to fall out of employment from fully employed to less employed and unemployed. And of course, our goal for today then is for those who do pass through all the way to substance use disorder, moving them into recovery, treatment, and return to work. There have been many negative workplace factors that are contributing to the development of individuals moving down that continuum, but also once they are at full-blown substance use disorder, factors that keep them in that space. This includes, these factors are things such as working alone, being a traveler, therefore away from home and their supportive home environment, those who struggle with the juggles of home and work, job insecurity, having no sick pay, which is fairly common in some industries, having social relationship problems and difficult boss, and physically demanding or boring work. And of course, for those who already have mental illness, substance use disorder, or struggle with other personal problems, financial or relationship, these individuals more often have stigmatized feelings. These quotes on the right came from individuals who had opioid use disorder that I interviewed. The first one says, I was just super ashamed and embarrassed to say I can't do the work either because I'm hurting or I'm dope sick. Another person said, a lot of people don't understand. They don't look at you the same, so I just don't. I'd rather be looked at like a normal person. As I mentioned before, there's a continuum, a pathway that individuals who develop substance use disorder experience. But we also need to match that up with the continuum of care. For those who have no problem, prevention is preferred. Treatment is offered for should be offered for those with substance misuse and, of course, substance use disorder. But today we're really focusing on recovery, the recovery for following initial treatment, the recovery for return to work. So goals of a recovery-friendly workplace, there are two main goals. The first one is to address workplace factors that cause or prolong substance use disorder. The second one is to lower the barriers to seek and receive care and maintain recovery. Successful recovery is highly likely in many situations, and it is more likely for those individuals who actually are part of a supportive environment. And here we're talking about having the workplace be part of their supportive environment. So what motivates employers to want to create a recovery-friendly workplace? It seems there are 4 reasons why employers are motivated. 1, they've lost a valuable employee, or they're likely to lose a valuable employee because they have zero tolerance drug use policies. Others may be motivated because of a personal or company experience from someone who's overdosed, or having a limited worker pool, and maybe the available workers more often have a substance use disorder, or maybe they're in a rural setting. And finally, managers sometimes just want to do the right thing. They recognize the value in all employees. So I'd like to share a video that we created for this presentation from an employer who has a recovery-friendly workplace program.
Tower Rock has had procedures in place for 15 to 20 years. We had a couple of really good, well-trained, or at least one really good, well-trained employee that developed some problems. If you've got a good employee, you know it. If you've got a good operator, you know it. At that period of time, we had a zero tolerance policy, one and done. We had to come up with a method other than zero tolerance. How can we retain these people, give them the opportunity to get healthy again, and retain them, because they are much more valuable to us as a healthy employee. We knew what their abilities were, and we knew them as people. We knew them as friends. We couldn't just give up on them because we've had too much history with them, too many good times, too many bad times. It's very common to have concerned employees say, I'm really worried about this person, and it's not for a spiteful reason, it's not for a personal reason, it's simply because we all have to operate together here, because if something goes awry, people get seriously hurt and or die. I have really seen nothing more than appreciation from those folks, and it's all anonymous. We just make sure that the folks know it's available. Come to us first, and things will be so much easier. We don't apply any disciplinary procedures. We will give them any amount of time they need. You can take up to a year off of personal time to get yourself help and get yourself healthy again and still not lose your job. I know it's working because I've had people say, yeah, I need some help. We've probably had more successful cases of somebody coming to us first and saying, hey, I need some time off. I need to get well. I need to get things straightened out in my life. And they know if they come to us first, then they're not automatically going to get released. I hope that we see a little bit of a shift in an attitude on what can we do to retain the people we got, as well as offering these new people some advantages that we really do care about you and we want you.
So that was a wonderful explanation from an individual who obviously has had a recovery-friendly workplace in place for a period of time. But now I'd like to share with you a story from an employee who actually was unemployed, sought out jobs. She was in recovery and sought out jobs, and somebody took a chance on her. And here's what she experienced.
My name is Sarah, and I am a recovering addict. I was addicted to methamphetamines, to alcohol, to marijuana for about 5 years. I was actually homeless. I was desolate. I was in and out of jail, places that I would go to try to find work, to try to just dig myself out of the pit that I put myself in. People would just look down on me. They would really, truly cause me to feel super less than. And whenever people feel less than, they have no desire to want to be more than. My recovery journey actually started before I got with Citizens Memorial Healthcare, but Citizens Memorial Healthcare actually helped me jumpstart my new life. In January of 2015, I was hired for CMH. I was really scared, and I was really thought that I had not enough to offer, that there were so many people better than me that were worthwhile in this job, but CMH still took a chance on me. And so in that, I was able to build relationships with different healthcare providers, with my own team, with people from human resources, with the CEO himself, who was a very, very sweet man. And from there, CMH allowed me the opportunity to grow. They allowed me the opportunity to be able to be seen as more than an addict, to be seen as more than somebody with a lot of baggage. One thing with addicts, with recovering addicts, is very, very important, whether we like to admit it or not. Boundaries are so incredibly needed. And that's where policies and procedures come in. So I knew that if I did wrong, the consequence of that, and there would be no question of it. But with that, there's also grace and that understanding of being able to learn and to be taught and to be guided to a better direction too. CMH gave me the opportunity to be able to work with our patients. I fell in love with healthcare. I fell in love with people. I fell in love with food. Almost exactly a year ago, I actually just became the nutritional services director of the entire department. And so to think about how CMH and my recovery allowed me to go from the bottom of the barrel, where it was jail, homelessness, I was flopping house to house, to now I have a house, I have a family, I have a job I can be proud of. And to know that CMH and my recovery friendly workplace and all these initiatives around me were able to speak that life into me.
So now we hope that gave you a little background into what causes things, how people enter the process. But we'd like to next hear from Dr. John Narine. John is the founder of Recovery Friendly Leader, a nonprofit organization whose mission it is to empower leaders with solution-based strategies to support employees impacted by addiction and promote safer, healthier, and more productive workplaces. John is linked to the state's recovery-friendly workplaces, and so he will be talking about that. Thanks, John, for presenting.
Can you hear me okay? Can you see my screen as well?
Yes.
Okay, awesome. Hi, everyone. Yes, my name is, I changed my slide. My name is Dr. John Narine, and I am very excited to be here today. I'm a person in recovery, and what that means for me is today I no longer try to manage or control an unhealthy relationships with drugs and alcohol. Why? Well, because when I tried, I wasn't good at it. If I was controlling it, I didn't enjoy using it. And if I enjoyed using it, I was out of control, not controlling it at all. So abstinence is the path that really works best for me. It's funny, that last video played, I smiled throughout the whole thing because I don't know if anyone else noticed, but Sarah, I think her name was smiling, going, "Hi, I'm a meth addict." And I remember first being in recovery and people would come and share their experience to try and help me, and they would be smiling and joyous and admitting that they had this problem and all these things they went through, and I would just judge them like, "You've got to be crazy. You went through all this stuff. How are you happy? How is it possible that you can even be smiling about that today?" Because I was just in so much shame and embarrassment and guilt and just living in that, and I just didn't understand. And today I have been blessed to experience the freedom that comes with admitting who I am, because there has been a solution given to me by doing that. And I love that video. Let me just put it that way. Thank you for sharing that. But there was a time where alcohol and drugs did serve me. It did what it was supposed to do. And it really became prevalent as I was an employee in the workplace. See, when I was sober, I would be that high functioning employee. I love to impress my boss, the partners, go above and beyond my job description, take the client out for drinks, go out for the company happy hour, especially if the company was going to pay for it. But then the problem started to get worse for me. See, I would be that employee that maybe doesn't show up on Monday and wouldn't turn in the things that needed to be turned in on Tuesday. I started to really escalate downhill. And it became noticeable that the consequences of me drinking were much different than my other coworkers. The companies I worked for really did the best they could to support me, someone that was struggling with substance use, but they never had the proper training for how to do that. So ultimately, it resulted in my termination. My journey through recovery has not been easy, but there were two essential ingredients that I've recognized were needed. One was opportunity, and the second was willingness. And there was a lot of times that I really needed help finding both. But how I got into recovery was really by surrounding myself with people who could show me what it meant to live a better life, who could set that example for me to follow, including helping me realize that, if I really ever wanted a job that I was going to keep or a life that I could maintain, I had to put my recovery first in my life. That nothing could come before that. So what I've seen is that employees need the same thing. They need leaders who can influence this positive change and give them that practical support and guidance that they need in the workplace as well. So that's really the point of what I'll be presenting to you today. Recovery Friendly Leader is our nonprofit program on how managers and supervisors can do that. We train in its simplicity, we train managers and supervisors how to support employees in recovery. So through our research and experience, what we found is that our program really works best when we work with an employee who's placed in a position to support others, right? And care for their needs. So that's manager, supervisor, maybe someone in HR, organizational development, possibly an EAP. We also know that a manager or supervisor really can't offer an employee something like maybe flex time to go to a meeting or a mental health day if the workplace doesn't allow it. And we also really want to be careful of training a manager how to help employees maybe feel comfortable coming forward and asking for help if the workplace has zero tolerance culture, because we don't want to cause more harm to either the employee or the workplace. So we're really looking for leaders who work in an organization that's really going to champion and support their efforts of supporting these employees. That's why the Recovery Friendly Workplace initiative is so important. So by definition, this is Colorado's adopted definition. A recovery-friendly workplace is an organization that uses evidence-based policies and practices to unite the entire organization by recognizing recovery from addiction as a strength and being willing to work intentionally with people in recovery. So what that looks like is the recovery-friendly workplace is going to assess the organization that managers and supervisors work in and ask, do these leaders work in a environment that actually has the ability to support the things that leaders need to implement strategies to support these employees, or does it not? And how that happens is the recovery friendly workplace assesses if the organization's principles align with the culture of diversity, equity, inclusion. They've enforced policies that align with that culture and principles, that facilitate some type of education to employees to increase the safe and healthy attitudes and behaviors at work. And they engage in customized leadership training, such as the things that we can offer, so that these people truly understand the purpose, objectives, and practices of the recovery-friendly workplace. A little history. So this initiative, the Recovery Friendly Workplace Initiative, began about 5 years ago in New Hampshire. Their governor, Governor Sununu, saw that there was a need to help employees struggling with substance use in their ski resorts. And then it just snowballed from there into a program that currently has over 300 employers in New Hampshire, with over 90,000 employees being supported in New Hampshire. I'm excited to say that as of this year, there are over 30 states participating in this initiative. Now all these states also partake in what's called a multi-state community of practice meeting that's led by New Hampshire. In these meetings, states share their experience with the initiative, challenges that they're seeing and best practices, so that everyone can learn how to drive this forward in their state, including in Colorado, the state that I reside in. Here in Colorado, we have a recovery-friendly workplace toolkit that's fully developed. This is a comprehensive document that really goes over the 5 steps an employer takes to become recovery-friendly and supportive to either employees struggling with substance use or seeking to maintain their recovery. Currently, Colorado has established a community work group where, as of last week, 87 individuals gathered together to plan what is the process going to look like in our states for an employer to openly say and be designated that they're a recovery-friendly workplace. We discuss things like what training will be necessary, who will be officiating or signing the certificate of designation for employers. These stakeholders are made up of people in recovery, government officials, HR, EAP reps, union members, really anyone who has an interest or any experience with how to make this successful in our state. It's open for anyone to join, let me put it that way. Hopefully your state, those of you on this call, is one of the ones highlighted on the screen, but do not be alarmed if it is not. As of July of last year, the White House published its National Drug Control Strategy, advocating for more states to participate in this initiative. So we need people across the US to continue getting this going in their state. Governor Sununu in New Hampshire invites your state to participate, and how he's doing that is he's created what's called a governor to governor letter, where anyone in your state, no matter who you are, can email, and I'll show the email later, and request this letter to be sent to the governor in your state. If your state is if you are one of the states that currently don't have an initiative on the screen but want to know what your company can do right now, at the end, I'll provide a link to Colorado's Recovery Friendly Workplace Toolkit. And if you're not sure how to get the initiative started but want to, and are thinking about maybe requesting the letter, you can also reach out to me. Maybe I can help connect you or guide you on where you can get started in your state too. So another short story. Years ago, I was an operations manager at a law firm, and this law firm was technically a recovery-friendly workplace, meaning they had everything to support someone in recovery: the culture, the principles, resources, flex time. They had everything but the training. So when I struggled and I came forward and asked for help, they didn't know what to do. And unfortunately, this is something that's come up more and more in advising sessions I've had with employers in our state. They're not really sure what to do when an employee says that they're struggling. So what we've done is we researched through the lived experience of leaders who had this same experience and asked them, how do they support someone struggling? And how are they able to do that while maintaining the safe, health, and productivity of the whole organization? And through this research, we're happy to say we found some solutions. So what we want to do in our program is make sure that leaders understand that now that they're working in a recovery-friendly workplace, that they know how to tell if an employee is struggling ahead of time. What signs to look out for, how to become familiar with your employee's personality and characteristics, and ask yourself, is this employee a little off today? Not necessarily everyone who's off is using substances. They might be sick, right? Or something might be going on financially or maritally. So there are things we can look for, but we ask ourselves, is it starting to become a pattern, right? And can we be genuinely concerned if something is going on and not come at it at a punitive attitude or approach? We want leaders to understand that if an employee is struggling, that they know how to address that employee, know how to speak to them. We go over a method that's used by employee assistance professionals, or EAPs for short. It's called constructive confrontation. This teaches how to have these conversations, what to say, what not to say, how to motivate them towards productive behaviors in the workplace, how to meet them where they are and really help them based on what they're willing to do. And also, we're truthful about this. So being helpful also considers some appropriate progressive disciplinary action, if that's needed. Remember, we're going to look out for the health of not only the employee, but the organization as a whole. Also years ago when I was struggling, I remember HR had found out about it and they gave me a call and they suggested that I use the company EAP. They said it was possibly help, there was free counseling, and I kindly thanked them and hung up that phone really fast. And I did not use them at all because, one, I did not know what the EAP was going to tell my employer. Two, why are you suggesting it? Three, I'm not going to ask you if it's confidential because I'm going to be worried that you might wonder why I'm asking. All these things were going on in my mind, so I just never used it. And sadly, this is happening to many employees in all across the US. So we want to help leaders understand the things they can do to not only help employees become familiar with these resources that are supportive, but also how to help them believe that they're supportive and confidential. So we have leaders who say they take an extra step. One leader has said that they show their employees the EAP report that they get back. It has nothing. It doesn't tell me who's using them. It doesn't tell me what you say. And as a result of doing that, they've seen an increase in volunteer use, which is what you want, right? You're paying for the service for your employees. Why not have it utilized as much as possible? So what they're doing is working. And that was beautiful to hear. And also we're going to help employers understand how to take the steps to address smaller issues before they become bigger problems, right? Sometimes employees in recovery are sometimes overlooked as a population that needs support, right? Maybe they're doing well, they have years, right? They got it, they don't need anything. Well, that's not always true. We want to encourage these employees in recovery to stay in recovery, right? That's a method of prevention as well. We don't want, if they're having some problems, how can we help them just address those so that they don't have to go back and revert to use? Sometimes that means finding a compromise between what's going to work for the employee and what's going to work for the workplace. I had one leader tell me that they had an employee that just recently got out of treatment and wanted it. This was in a restaurant and wasn't comfortable enough with the closing shift. Why? He didn't want to be alone with the liquor at the bar and found the courage to request, hey, can you help me cover my shift? Can I have a different shift and can you switch? And they were able to find that compromise. It worked. And now it's successful for both the employee's recovery, for their job, and for the workplace. The bottom line here is that some of the things employers that have told us is that employees are starting to trust their employers more. And when that happens, these employees were more likely to tell their manager that they're in person recovery or struggling. And they were able to access supports earlier because there was less stigma and barriers present. And I had one leader specifically tell me, he's just happy he gets to have a healthy and productive employee because that's giving him the best value for his payroll. I mean, what more can you ask for? So our program currently is set up to offer 3 levels of training, 1 hour, 2 hour, and half day here in Colorado. All are customizable based on the needs of leaders, employees, and the organization. We have both an in-person and virtual option for up to 20 people. It includes a copy of the book, Leading Workplace Addiction, which is the published research that really founded this program. The 2 hour and half day session also includes an advising session with myself. We are very proud to say we're recognized by the United States Department of Labor as a resource for employer training. We have a partnership with the Recovery Friendly Workplace Initiative so that businesses can be referred to our program through there as well. And we're working on plans to implement our training with the Associate General Contractors of Colorado, who also participates in the Recovery Friendly Workplace Stakeholders Work Group. They have a voice in Colorado for how this can help their industry in Colorado, which is so beautiful for us. I'm not sure if you can tell, but I'm really excited about this program, this initiative in the years to come. There's so many employees out there they're just like I was. They're trying to do the best job they can and just sitting in silence and suffering on the inside, not knowing what to do, who to trust, how to get help. So those are the employees that really need us, and we are working our butts off to get to them. As promised, these are the resources I mentioned throughout this presentation. I think Anne will distribute them out to everyone after today's session. And I don't know if we have time left, but I'm available for any questions that you guys might want to ask.
Thank you, John. That was that was excellent. And yes, we do have a couple of minutes for questions. So at this point, if you have a question, if you want to enter it into the chat, we're also hopefully we'll have time for questions at the end of the next presenter's presentation. And as John said, yes, we will be sharing out all of the slides with the participants on this webinar. We thank you for attending again.
It looks like Caroline has a question. I'm curious if there is any descriptors people use that is layperson friendly and easily understandable when describing EAP to others. Good question, Caroline. I think the way I've been describing is EAP is a service that employers can get for their employees that offers short-term counseling, usually 3 or more sessions per issue. So if someone has an issue with substance use, they can call, get some free counseling sessions, maybe 3 to 8 generally. And if they a month later have a problem with some financial issues at home, they can call for that issue and get another free 3 to 8 sessions for that. Again, I'm generalizing the amount of sessions, it will differ. EAPs will also provide referral assessment and referral service, maybe to treatment or other supportive resources, and some follow-up services to the employer. One thing I really enjoy about the EAP is that they will help coach the employee on how to advocate for the accommodations they need in the workplace, right? This is how maybe you can tell your manager, maybe this is how much you can relay. You don't have to tell them everything. They really can act as that coach for the employee.
Okay. Well, thank you, John. Thanks for sharing. You want to go ahead and stop sharing, and Jamie will go ahead and bring up her slide. So our next presenter is Jamie Osborne. Jamie is a public health analyst with the Office of the Director of National Institute of Occupational Safety and Health. Jamie works on NIOSH's Workplace Supported Recovery Initiative, as well as the Recovery Ready Workplace Initiative that is being led by the Office of National Drug Control Policy, or ONDCP. So thank you, Jamie, for sharing.
Thank you, Anne-Marie. Can you hear me all right?
Yes.
Perfect. Okay. It is storming here in Atlanta, so just to make sure that I conserve bandwidth and maintain good connectivity, I am going to go off camera just while I'm presenting, but I will be back for the discussion and the Q&A. Give me a minute here. All right. So thank you again to the Healthier Workforce Center of the Midwest for inviting me to speak with all of you. I also want to note that I do have a little senior dog here with me who is quite sick, so I do apologize for any background noise, but I've done everything in my audio settings to suppress that, so hopefully there won't be any interruption. To repeat, my name is Jamie Osborne. I am a public health analyst and a certified health education specialist, currently on contract with NIOSH, and again, based in Atlanta, Georgia. I wear many hats at NIOSH, but my most prominent and probably my personal favorite is my role working with Dr. Casey Chosewood and the NIOSH Office for Total Worker Health on the NIOSH Substance Use Prevention and Recovery portfolio. I was asked to share a little bit about what's going on at the federal level to support recovery among workers and in workplaces. So I'm hoping to illuminate some of that work for you today. But just as a little caveat, I just want to say that this is definitely not an exhaustive list of what's going on in the federal sphere, but rather just a highlight of work that NIOSH has accomplished and things that I've directly contributed to that I can speak to. All right. I may be preaching a little bit to the choir here, given that the Healthier Workforce Center is one of NIOSH's Total Worker Health Centers of Excellence, but since NIOSH applies the Total Worker Health approach to all of our substance use prevention and recovery efforts, I just wanted to quickly spotlight the benefits of that approach. So for those of you who may be unfamiliar with Total Worker Health, let me first define it for you as policies, programs, and practices that integrate protection from work-related safety and health hazards with the promotion of injury and illness prevention efforts, all to advance worker well-being. So we know that the workplace and work contribute to worker safety, health, and well-being, and therefore work can be modified to improve those outcomes, right? And we also know that there are inextricable relationships that exist between many different safety, health, and well-being issues, not just on the job, but also off the job. Many safety and health issues clearly straddle both work and non-work spheres. After all, while we may only wear our worker hats during a portion of a 24-hour period, we can live with those work-related health and safety issues 24 hours a day. Workers do not check their identities or their personal lives at the door before entering an office or a work site, the same way that it's impossible to not bring home stress or health or safety issues that are experienced at work, right? So the total worker health perspective views the worker as a whole person and considers whole health impacts. And substance misuse, substance use disorders, and overdose are issues that are broadly impacting workplaces, from the worker to workers' coworkers, staff, family, and the community. And as the lines between those environments really have started to blur in the wake of the pandemic, it's really more important than ever to use a coordinated systems approach to meet the needs of employers and workers. So NIOSH applies total worker health principles and strategies to combat substance use harms, which really is vital to meeting the needs of workers more comprehensively, more completely, and more efficiently. And research has shown that traditional occupational safety and health and worksite wellness programs, and by that I mean non-integrated, standalone, siloed approaches, they've had a favorable impact. However, we know that for tackling the wide-ranging, complex concerns of workers, integrating those protection activities with health-enhancing ones may be more efficacious than concentrating on either of these activities alone. So to that end, the total worker health scientific evidence base has been building for 2 decades now. Studies have shown that emphasizing a total worker health approach, and by that I mean a holistic, expanded, transdisciplinary strategy, really engenders more promising efforts and results. So the promise of total worker health is vast. It extends not only to the worker and the employer, but also beyond to family, community, and society. And workplaces really represent a critical point of contact for those who are struggling with or recovering from a substance use disorder. So NIOSH has developed guidance for establishing what we call a workplace supported recovery program, in which employers use evidence-based policies, programs, and practices to reduce multiple risk factors, help workers seek the care that they need, and provide assistance in recovery. Ideally, these workplaces will provide individual, family, and community support to improve the well-being of all of its workers and create work environments that really proactively prevent substance misuse, reduce stigma, and encourage treatment and sustained recovery. So a recovery supportive workplace really understands the true nature of substance use disorders and recovery, as well as the factors that support the initiation of treatment and the maintenance of recovery. It encourages employees to seek treatment and initiate recovery early in their disorder, and it provides access to evidence-based supportive resources. This might include developing return to work plans, supporting second chance employment, providing workplace accommodations and other return to work assistance, and also providing peer support and peer coaching to bolster the social supports that are available to workers in recovery. So NIOSH has identified several areas of consideration for employers who are wishing to cultivate a recovery supportive workplace. You'll see those listed on the slide here. In the interest of time, I'd like to highlight just a few that I think are of particular importance. The first being stigma. Reducing stigma can really help to encourage entry into treatment and maintain recovery. So to help reduce stigma, workplaces really should provide educational materials, talk about the true nature of substance use disorders and recovery. And a key talking point there is that a substance use disorder is not a moral failing and recovery is possible. Workplaces should provide training to managers and workers to overcome misunderstanding and biases against individuals who have substance use disorders or in recovery. Adopt policies in the workplace to raise awareness and support workers and their families who might be struggling. Eliminate imprecise or pejorative terms from workplace language, and instead use more clinical language that is more consistent with terms used for other health conditions, right? Because we know that substance use disorder is just a chronic health condition like many others. And of course, we want to make sure that workplaces are ensuring that all of their substance use policies are informed by science and supported by data. Another consideration for workplaces is a sensitivity to disparities, right? So workers across all age ranges, races, ethnicities, and organizational levels within the workforce can engage in substance misuse or develop a substance use disorder. However, barriers to treatment and the willingness to enter treatment and recovery may vary across these groups based on factors like religion or cultural norms or expectations, family history, age, education. So employers should really consider having expertise available in their EAP programs or their health insurance programs to address these differences across various demographic groups just as needed. And of course, potentially the most important is employment. Employment provides economic stability, a meaningful social role, and often direct access to treatment and recovery services. Employment also provides relevant sources of recovery capital that can motivate and maintain a desire for treatment and recovery. So recovery supportive employers and workplaces really aim to preserve employment whenever possible for those with a substance use disorder and provide second chance employment for those who are recovering and attempting to enter or re-enter the workforce. So Dr. Chosewood and I partnered with Dr. Michael Frone to write a paper recently on workplace supported recovery, which was published back in December in the Occupational Health Sciences Journal. Despite the acknowledged importance of employment for substance use disorder recovery, there really is little conceptual or empirical work on how the workplace might support or undermine recovery. So in writing this, we really set out to take a first step in that direction. To promote a better understanding of recovery for occupational health researchers, we provided just a brief overview of the nature of a substance use disorder, prior definitions of recovery, and general themes associated with the recovery process. We did develop a working definition of workplace supported recovery, and we developed a conceptual model showing how the workplace might impact the recovery process. And using this model and research from the substance use and occupational health literatures, we also developed a series of general research propositions for moving us forward. So our overarching goal was really to motivate innovative conceptualization and research on workplace supported recovery from substance use disorders. That research may inform the development and evaluation of workplace interventions and policies like recovery-friendly workplaces, supporting recovery and highlighting the benefits of workplace supported recovery for employers, for employees, and for communities at large. So here I have a link to the public access paper. You can read the entire thing online. We also have a NIOSH science blog here that we published promoting the new research and just summarizing it in more plain language, so it's a little bit more digestible and shareable. And here is the model that we developed while writing the article, and I do apologize for the less than stellar quality. But at the center of the model is a general depiction of the recovery process. And the first indirect path from a substance use disorder to recovery through treatment represents assisted recovery. So having a substance use disorder would motivate entry into treatment, representing any combination of formal treatment with or without medication assistance, and then formal peer support networks. So think Alcoholics Anonymous or Narcotics Anonymous. Treatment would then increase the likelihood of abstinence, which increases the possibility of reduced clinical symptoms and broader recovery efforts and outcomes. And the second indirect path from a substance use disorder to recovery represents unassisted or natural recovery. And then finally, there at the bottom, you'll see that there's a feedback path indicating that if recovery efforts are interrupted, a recurrence of the substance use disorder may recur, thereby beginning a new cycle. And the model also shows where work conditions might impact the recovery process. So the work environment may play a role in the development or perpetuation of substance use or SUDs, which is depicted by the two broken lines. And the solid lines emanating from the workplace recovery hazards and supports boxes indicate that aspects of the work environment can decrease or increase the likelihood of initiating and completing treatment, maintaining involvement in peer support groups, achieving and sustaining abstinence, maintaining involvement in long-term care if that's required, rebuilding parts of one's life that may have been damaged by a substance use disorder, and then developing and sustaining improvements in physical, mental, and social well-being. And that really is the essence of recovery, right? So given the lack of systematic research on the associations between the workplace and recovery, we don't really know which of these hazards or supports will have the greatest impact on the recovery process. But in the paper, we do explore some potential candidate workplace hazards and supports for workplaces to consider. And our hope is that all of this can help researchers really take a holistic view of the various associations that need to be understood in order to develop a broader understanding of the recovery process within the workplace. NIOSH has also developed a portfolio of information and resources for employers, workers, and workplaces, all of which can play a role in a comprehensive workplace-supported recovery or recovery-friendly workplace program. And all of these can be found through our Opioids in the Workplace webpage, which is linked here. But in the interest of time, I want to highlight just a few. NIOSH has developed a fact sheet titled Using Naloxone to Reverse Opioid Overdose in the Workplace, which can help employers and workers really understand the risk of opioid overdose. And it provides guidance to help them decide if they should establish a workplace naloxone availability and use program. And the fact sheet also provides really practical, applicable guidance to workplaces wishing to establish this kind of availability and use program, including information and considerations related to liability, training, maintenance, and as well as just practical information about purchasing and storing naloxone. And for workers who are struggling with opioid misuse or opioid use disorder, medication-assisted treatment, MAT, also known as medication-based treatment or medications for opioid use disorder, can really be an integral part of treatment and recovery. Definitive treatment is an essential part of the long-term solution for substance use disorder, and medication-assisted treatment is really the gold standard. Employment and return to work strategies are critical, and medication-assisted treatment really contributes to more stable long-term employability. So towards that end, NIOSH has developed what we call a workplace solutions document, which provides information for employers who are wishing to assist or support workers with opioid use disorder. It describes the current treatments, and it also provides a multi-step set of information on creating a workplace atmosphere that focuses on prevention, opioid misuse minimization, decreasing stigma, and supporting people with opioid use disorder through treatment and back to work. Additionally, for those that are on the front lines of the crisis, NIOSH has developed an illicit drug toolkit, which provides accessible NIOSH recommendations for how first responders and healthcare personnel can protect themselves from exposure to illicit drugs, including fentanyl. And again, all of these resources can be found on our Opioids in the Workplace webpage, which is linked here. We are currently in the process of updating our guidance around fentanyl exposure just to align with the best and most recent science. So do keep your eyes peeled for those changes in the coming weeks. I also wanted to touch on some interagency working groups that NIOSH participates in. The Biden-Harris administration identified promoting the adoption of what they call recovery-ready workplace policies as an element of its strategy to more effectively respond to substance use disorder and the epidemic of overdose fatalities. So as part of its efforts to help the nation and the economy rebound from the impact of the COVID-19 pandemic, they've established this new initiative. The widespread adoption of recovery-ready workplaces across federal, non-federal, public, and private sector workplaces really has the potential to increase the number of Americans who are able to achieve and sustain recovery, and to really contribute significantly to efforts to rebuild workplaces and workforces that may have been depleted by the pandemic. So NIOSH has been working with the Office of National Drug Control Policy, or ONDCP, and the Domestic Policy Council in a work group titled Recovery Ready Workplaces. And our goal is to identify and drive policy actions that facilitate employment opportunities for people who are in or seeking recovery from substance use disorders, and also promote the adoption of those recovery-ready workplace policies. Other agencies involved include DOL, DOJ, USDA, DOT, VA, many others. It really gives priority to advancing the administration's goal of expanding the adoption of these policies, with the ultimate aim of helping American businesses become more productive and profitable, creating healthier and more resilient workplaces, facilitating help seeking for employed persons with substance use disorder, and then helping Americans in recovery return and contribute to the workforce. Additionally, NIOSH, along with the National Center for Injury Prevention and Control, or NCIPC, represents the CDC on a new work group on recovery research, and that is also led by ONDCP and NIDA. And our goal in that work group is to develop, prioritize, and coordinate the implementation of a federal recovery research agenda. So through this work group, we are assessing the current scientific knowledge of recovery from substance use disorders. We are reviewing federally funded research, evaluation, and data collection portfolios and strategies. And we are identifying areas where additional research, evaluation, and resources are needed. And in addition to identifying those priority recommendations, the work group will also determine where existing authorities and resources permit the allocation of or the reallocation of research and evaluation funding to identify priority research priorities and where additional funding may be required to increase an existing effort or to establish a new one. So that's going to be really important in the upcoming budget as well. I believe that John touched on this, but the new Recovery Ready Workplace Resource Hub, which is hosted by the Employment and Training Administration of the DOL, is a product of that Recovery Ready Workplace Interagency work group that we were a part of. The Resource Hub provides great information, guidance, tools, best practices, and really a range of other resources to help both public and private sector employers really effectively address substance use disorder, hire people who are in or seeking recovery, and support recovery within the workplace. There's also a toolkit that's going to be made available through the hub. It's currently nearing completion. I believe it's actually in the review and clearance process right now. So if you haven't already, I really encourage you to check out this very rich source of information and resources and continue checking back. We're always expanding and updating on the hub. And in addition to these interagency work groups, NIOSH also has its own internal work group, the Substance Use and Work Coordination Team. This is a transdisciplinary group that meets quarterly to discuss updates from across the Institute, including report outs from our various subgroups, which I have listed here. The newest of which being our cannabis work group and impairment work group. We're seeing a lot of interest there from employers. So we're trying to get some resources developed and some web content up right now. We do occasionally have external folks join these meetings to discuss new research or projects or collaboration opportunities. So if you'd like to learn more, please feel free to reach out to me after the meeting. All right, and that'll be all the time I have for today. I hope this was helpful. I have my email here. I'm happy to answer questions, connect with you after the meeting. I believe Anne-Marie is sharing my slides. And if there's anything else I can do to help support the important work you're all doing, please just feel free to reach out.